I heard they gotten tons of applicants.
I think so. I think it helps because they're really close.
Hmm.
I think a lot of people are kind of wanting to like stay close to home.
But they need to make like a pipeline program for the for your school so that you can go into that school.
I hope so. That would be wonderful. Whoops, I did not mean to change the slide. Okay, so for those of you that just came in, if you're new and this is your first meeting, go ahead and say hi in the chat box, and that's how we're gonna log your hours. So type your full name. If you have like a nickname on your profile, make sure you type your first and last name so we can differentiate you guys, because I know we have a couple of duplicates. So make sure you get your last name in there. And then for those of you that are new, welcome to Shamos. So we cater to like a variety of healthcare professionals. So we do have a lot of pre-med students, a lot of pre-nursing students, but we also have some other students like psychology, pharmacy, dentistry, forensic pathology, that kind of thing. So hopefully, you guys can maybe find something that you like or a speaker that you like and get resources that you need. So, like I said about Shamos, so we focus on giving you resources so that you're a well rounded student and a better future healthcare professional. We have a different speaker every single week. So, hopefully, you guys get as much information as possible. A lot of our speakers that are practicing physicians and stuff will let you shadow. You just have to ask them. So, definitely make the connection where you can. And then our meetings are every single Thursday at 6 o'clock. This semester, they're all going to be via Zoom, and there's not going to be any in-person meetings. If you do miss a meeting, the video will be uploaded to our YouTube. We'll send you a link. We'll send you a quiz. And then after you take the quiz, you just send us a screenshot of your results, and then you'll get credit for the hour. And then we are on social media, so follow us on Instagram. We have a group me, so email Daniel or message any one of us through email if you want the group me link. Join us on OrgLink. That's going to be a requirement for all members. If you're not on OrgLink, by the time you pay dues, then you're not a member. And then we are on Facebook. Okay, so like I said, OrgLink. I have to stress it because it's really important. If you don't join on OrgLink, it's a problem. Even if you pay, if you're not on OrgLink, you're kind of sort of hosed in so many words. So definitely go to OrgLink, search up Shamos, will pop right up. This is kind of what it looks like on like your personal page when you search us up. And then click, there should be a little button in the top right hand corner that says request to join. And then you click it, and then it'll send us a notice, and then we approve you. And then another part of being a Shamos member, you have to earn 10 service hours. Even if you pay dues and everything, if you have less than 10 service hours, then you're considered a part-time member instead of a full-time member. And then we will send out a email that has an hours log and a welcome packet that has a lot of really good information. For the hours log, make sure it's only non-meeting and non-blood drive hours. So it's like if you volunteer at a hospital or anything that's not Shamos related, you can log it there, and then you'll turn it in at the end of the semester, and those hours will count as well. And then dues. So we are doing something a little bit different. So dues are due by February 18th. For $10, you can get a mask. For 20, you can get a shirt, and then for 30, you can get both. So just make sure you tell Joseph what size shirt you are if you want a shirt, or if you just want a mask, just let him know. And then if you want both, make sure you tell him the shirt size so we don't get you the wrong thing. And then we do have a Cash App and a PayPal. And then if you have any questions, make sure you email Joseph down here at the bottom. And I'll upload this PowerPoint as well onto OrgLink so you guys have access to it. And then this is our semester shirt and the mask. So they turned out really well. I'm really happy. So usually we do have a heart walk. We're gonna have a virtual heart walk this semester. So I just kind of we wanted to kind of integrate that into our shirts. So this is our semester shirt for everybody who wants to know if you're trying to decide if you want a shirt or a mask or both. So volunteer and hour opportunities. So every single meeting is worth 1 hour, and then you have the blood drives, food donations to the Sam Houston Food Pantry, 3 items is 1 hour. Reedy B. Huff, 3 items is 1 hour. And then the Alzheimer's Association is $5 for 1 hour. And then also, I forgot to add it on here, but if you donate to the American Heart Association the same way, $5 is 1 hour. Just let us know. And then any outside volunteering. Okay, so here is information about the virtual heart walk. So it's going to be basically how we're going to do it is from February 26th to the 28th, however many miles you walk or run, send it to Tyler, like a screenshot of like with your little help app or whatever you choose to use. And then for every mile, it's going to be 2 hours. So there's another hour opportunity and you can stay fit. Okay, so another hour opportunity. This is happening tomorrow. I know it's a little bit short notice, but I just wanted to throw it out just in case. Is the Tri-Beta habitat restoration from 2 to 5 p.m. This is, we'll also send out another email about this too, just in case you guys are interested. Basically, you'll just show up, jeans, t-shirts, whatever, and then you'll be clearing out underbrush. So here's the address and the information. You can take a screenshot, or like I said, I'll upload the PowerPoint to make it easier for you guys. And then blood drive opportunities. So we have a ton of blood drives. So you have a ton of opportunities to get blood drive hours. So if you donate, then you get 2 hours. That's for if you donate just red blood cells. If you donate double red blood cells or red blood cells and plasma, then you get 4 hours total. And then you get 1 hour if you attempt to donate but get rejected. And then 1 hour for every hour that you pass out flyers and recruit donors. All blood is being tested for antibodies for free. So if that's something that you're curious about, you can donate blood and find out. And then it's from 12 to 4:30 on all of these dates. And then it's located between the chemistry and forensic science building and the life science building on the second floor entrance. And it'll be in like a big mobile bus. It'll be really hard to miss. So if you have any questions, make sure you email Denise Garcia or message her on GroupMe and she'll get back with you on that. And then this is our blood drive coordinator's information. So if you need to ask her about any specific questions regarding donations or whether you're eligible or anything, this is her email. She'll be able to give you answers to very specific questions faster than we will. And then some future important dates and speakers. So next week and the week after, we have Joanna Footman. She's going to be from the Sam Houston College of Osteopathic Medicine. So she's going to be doing a kind of like a career prep kind of thing where we go over medical CVs and resumes. And then the next week, she's going to go over how to pick a medical school. So if you guys aren't sure what medical school you want to go to, that's going to be a really good meeting to attend. So keep that in mind. And then also, I literally just got this email from our advisor, the Southern Texas Swing Health Professions Fair. So originally, Sam Houston students weren't going to be allowed to attend, but now we are. So for the registration link, this is in the welcome packet. So whenever you go to the welcome packet, it'll have the link where you can register. It's for a ton of professions, a ton of different ones. I'll forward the email to you guys. But if you attend it, it'll be, whenever I counted, I believe it'll be worth 5 hours for Shamos. So that's definitely going to be something really good for y'all. And then I also wanted to bring up the undergrad research symposium because I just found out about this because I just did research and I'll be presenting it. This is for anybody. So if you have any type of research or you had a really good paper and a professor thought it was really good, you can technically present it as research. There's scholarships, it's a free conference, it's all virtual. So it'll give you the chance to kind of sort of get used to presenting research and then get feedback from it to see what you could work on. And then you can also network with other students and faculty this way. But you can visit the URS website, just Google I have the website here. And then it'll give you a lot more specific information if you're interested. Okay, this is about the Texas Spring Health Professions Fair. So like I said, it covers a lot of things. So if you're interested in osteopathic medical schools, Caribbean medical schools, or oh my gosh, I cannot talk. Podiatry, chiropractic, literally anything you can think of, they'll be there. So like Renee said, whenever you go to register, if it says it's for UH students only, just go ahead and make your profile. And then instead of the UH ID, put the SHSU ID, and then you'll be good. And then the spring semester scholarships. So the top 2 members with the most amount of hours will receive $100 each. So, yay, you guys can get money the more hours you get. So make sure you pay your dues on time, you earn the minimum number of hours, and then in the event of the tie, whoever has the most meeting hour scholarship, meeting hours will get the scholarship. So keep that in mind while you're earning hours. The more hours you get, the more chance you have. Okay, and then some other organizations that I wanted to bring up because I know that you guys may be interested in joining more than one org, or you're just starting out and you just kind of want to know. So there's MedLife. So they are a service learning organization. All of their learning opportunities are virtual. So that might make it a little bit easier and a lot cheaper for you guys if that's something you're interested in doing. They have their meeting on February 23rd, and their dues are $10. And I believe their service hour requirement is only 5. So if you want another org and you're interested in service learning and shadowing, I definitely recommend joining them. And then the Beta 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 Biological Honor Society, yay. Tyler can give you a lot more specific information about Tri Beta. But basically, our next meeting is next week, next Thursday at 5 p.m. It'll be virtual, and we will have a psychology professor researcher. So she'll be able to talk about her research if you're interested. If you're interested in psychology, she'll be able to give you more information. And then Tyler will be able to give you more information about whether you're eligible to join if you're interested. So just make sure you message him or email him. Yay! And now we have Dr. Juan Bustamante from Texas A&M Pharmacy.
All right.
Okay, so I stopped sharing my screen, so I think you should be good.
All right, so I can share?
Yeah.
All right. So can you see that?
Yes, that's perfect.
Okay, excellent, excellent. So I can add to that U of H meeting, the professional fair. That's something that if you want to meet a lot of recruiters and you're interested in certain schools, they're going to be there. So there's going to probably be like 5 different, maybe 6 different pharmacy schools there, if not more. There's going to probably more because it's all online. So you're probably going to have a huge number of medical schools. You're going to have a huge number of pharmacy schools, PA. I mean, you name it, just they're going to be there. And so it's a great opportunity to visit the school. Most likely there's going to be a school there that you want to go to. And so you can actually talk to the recruiter. What does it take to get in? This is my GPA. What do you think? That kind of stuff. It's very important that you start finding out what's going on. If you rely on other people to tell you what the prereqs are for something, if you rely on people saying, oh, you got to have 4.0, and then you're going to find out later, oh, you really didn't need a 4.0 to get into that program. For some reason you assume that's usually where the confusion comes. And so I would definitely recommend doing those things. I'd recommend talking to some people and finding out what they're looking at. And honestly, if you like, I talk to people all the time. I got students emailing me all the time. I had a student at 410 say, can I talk to you now? And I say, yeah, let's go ahead and talk. I talk to students all the time, and I see them from freshmen all the way through until they get to pharmacy school. And so recruiters' jobs, the people that are going to be there, their job is to meet you, get your information, provide all the information you need so that you can, and hopefully they're going to try to get you into their college. And so you're not bugging anybody by talking to them. So it's important for you to do that. So I would not hesitate on joining it. And so I'm not trying to do a big plug. It's something that you should do. It's just one of those things. If you're really interested in doing things, of getting to know, where you could possibly go, because it's a good thing. All right. So I am with Texas A&M College of Pharmacy. My name is Juan Bustamante. I'll give you a little bit of background. I grew up on the border, on the water. I'm on this side. I grew up in a little town called Zapata. I have a PhD in biology with emphasis in neurobiology, but I'm more of an endocrinologist than anything else. Reproductive research type things. I'm also so I'm a professor. I've been here since 2007. I've seen every single class graduate, and I'm also the director of admissions, the interim director of admissions. So I've been doing this for the last 4 years, and so believe me, I see people do things all the time, as far as that's concerned. So here's a QR code. So if you want to contact me, you want me, I need you to provide your information so I can email you. We can start having a conversation about our program and what we offer. And for those who don't know that, we have 2 campuses. We're real close to y'all with College Station, which is about an hour away. And then we're really far away in Kingsville. So I always tell people, if you like fishing, you like the beach, Kingsville is the place to be. If you like big time football, then obviously in sports, then College Station's up there. So You know, we have a lot of people that fish down here, but that's one of the big deals. But the beach is a lot of fun. So was that enough time for for the QR code? Everybody good with that? Okay. All right then. So the road to get into pharmacy school is actually can be shorter than most programs, especially medical school and dental. Most people have to graduate to get into pharmacy school. You don't have to graduate. All you need is the 75-hour prereqs. That's it. Average GPA, where you're going to be competitive in all pharmacy schools in Texas, is about 3.4. And the PCAT this year, I don't know if y'all know this, it was waived at most schools. There were already a couple of schools that had waived it, but then this year the COVID hit, they decided to waive it. So almost all the schools have waived the PCAT. So if you got a strong GPA, this is the year for you to apply for pharmacy school, and you don't want to take that test. So I don't know if y'all knew that, if y'all aren't part of it. So joining pre-pharmacy organizations, just like you're doing organizations now, is very valuable. One, you get to meet, you know, people from out that are trying to recruit you guys, but also you support each other. Like, for example, some of you guys are going to get into pharmacy school. Some of you guys are going to get a medical school this year. And so you can tell people this is how the interview process went. You know, this is what they do to you when you go there. So it's really important to stay connected so that you can start seeing that. And I highly advise organizations, hey, if you got in the pharmacy school, you got in the medical school, why don't you tell the other guys how it was? I mean, it's not a secret. Not everything is a secret. Some of it is, but not everything is a secret. And so obviously, you know, you don't have to have a degree, but having a degree just makes it easier for you when you get into pharmacy school. One of the problems with medical school, pharmacy school, any of those schools, is not the material. It really isn't. It's not the material. It's the amount of it. It's not how hard it is. It's the amount. You're going to have to learn how to time manage like you've never time managed before. I mean, you're going to have to learn how to optimize your studying, minimum amount of studying, maximum amount of learning. That's going to be a big deal for you. Because it's going to save you from being stressed and then you might actually get good night's sleep every once in a while. And so, you know, having more biologies, more chemistries under your belt, much better student. You're going to be much stronger, much easier. The pharmacy school will be a little bit easier, and you've seen these topics, right? And then so most schools, you know, it takes most people. I would say 40% of our students don't have degrees. So I just had a student. They've only been in college 2 years, and they're getting the program next year. And then I have students that they graduated and they're in the program like traditional. And then I've had students who are teachers, you know, teachers that do the you know, the health science center stuff. They come in and they decide, oh, I want to go into, you know, I got my kids are going to pharmacy school. Why can't I? And so they start coming in. So we have re-career. We have people who've been out of school for a while. And so we work a lot with those students. Pharmacy school in general is 3 to 4 years. Now, I warn you, if you do the 3-year one, it's 3 years straight. Summers are in there. The 4-year ones usually get a break in the summer, so that's always kind of nice. And then obviously you're going to go on to get your license. There's a licensing just like any of these different health careers that you have to have. And so that's important. And then a lot of people don't know pharmacists, and I'm going to talk about this today, and that's why I bring it up. You can do a residency program just like medical school. You know, medical school, you have residency programs. You can actually do that in pharmacy school. So there's it's a 2-year thing. So the first year, you can get that from anywhere. You actually go to 2 different places. The first year, you go to one place, and it's very general. So they're going to cover lots of different topics, even administration, and they're going to cover lots of areas. In your second year of this is when you specialize. So there's people that go on to their second year, and when they're done, they're cardiac pharmacists. They're actually infectious disease pharmacists, diabetic pharmacists, psychiatric pharmacists, which actually prescribe right out the door. And so they can prescribe within that. So that's something that's very interesting that people don't know. Pharmacists, like I said, they do work in lots of different environments. There's lots of different careers where you can be in, and you'd be surprised once you start exploring it, how different that is. And so I'm just going to go over some of the careers, and at the end, I'm going to hit on one career, infectious disease. And so a lot of these careers that are tied into pharmacy, I mean, you can do tons of things. You can get into policy. You can get into, you can specialize in lots of different things, management. I actually have a student that was with us that her whole job is actually to assess drugs that the hospital system is going to use. That's her job as a pharmacist, is to do that. And there's other people that go into policy. There's other people that work in other areas. So it's amazing all the different things that you can do as a pharmacist. A lot of people think, oh, I'm just working at Walgreens. I'm gonna be over the counter all my life. That's not true. There's tons of things you can do. You can get yourself put into a hospital, which is what people really get into. And of course, this is more the community. And I always tell people all the time, don't knock the community people. If that person has doctor on it, right? They have the name doctor on their shirt and their jacket. They actually are more trained than you think. When you go through pharmacy school, you start off first year is kind of basic over the counter stuff. We try to get everyone to the same speed because we have some people with masters, undergrad, and some with no degrees. But as you move through the program, it becomes much more clinical. When you're done on your third year, you're actually going to be doing minor physicals. So you're going to have to figure out what this. We have patient actors. You got to figure out, well, what do I need to do for this person? What would you give this person, and what are the side effects of the drugs? And you got to remember when you get out of when you're get out of pharmacy school, excuse me, when you get out of pharmacy school, you're the drug expert. There are no other drug experts, not even the doctor, not the nurse. You are the drug expert. That's the thing that's going to be your niche. And and because you have all this background, clinical background, if you ever go see a pharmacist and you're trying to get over-counter medicine, which is awesome, ask them, hey, I don't know which one is big. I feel like this. Can you help me? And yet, and they do. They really do help you. If they actually say you need to go to the doctor, you need to go to the doctor because they see cases. We actually practice cases. We go over cases. When they work in a clinical environment, in their fourth year, they do all these rotations. They're presenting cases. How would you treat this person? And they do rounds with doctors all the time. And so we're going to get into that type of person a little bit later. But over the counter people are well trained, and I would definitely take them very serious on what they say and recommendations they give. Ambulatory care is more of a one-on-one type situation. That's one of the clinics that we're going to talk about a little bit later, where you have your own patients and you have in and out patients. And so if you think about it, what's the biggest problem with people and medicine? They won't take them, right? That's the biggest problem. They won't take them, or they're not taking them properly, or gives them a side effect they don't care for, right? So a pharmacist is more qualified and will spend time with students, or that with students, with a patient, and say, okay, how many, what are you taking now? And what they'll do, they'll try to sort it out, and then whatever comes from that, they can actually consult with the doctor and say, hey, I recommend we switch this medicine because she's having bad reactions and we're not getting the outcomes we want. And when they're finding, when a pharmacist gets involved, they find out that they actually get better outcomes. There's actually a lot of data out there saying that pharmacists, nurses, and doctors working together, much better outcomes in patients, a lot better outcome in patients. And then compounding is one of those things that some people really love to do. They like making drugs. Compounding also falls under doing sterile products, drugs, IVs, things like that. And so there's a lot of people that go into compounding. The reason for compounding is what happens if you're allergic to all the components of the medicine. So a lot of people think like a pill, that the whole thing's medicine. It's not medicine, not the whole thing. You have to have a formulation that holds it together. And so some people are allergic to the formulation. And so then you may have to compound something, or they have one size fits all drugs, and obviously that doesn't work with everybody. So then you have to compound things for that. Okay. Sterile products, a lot of people don't realize that when you do radiation therapy for cancer, there's a pharmacist behind it making all those therapy medications. And so it's called nuclear pharmacy. And of course, you can go into academia. And then this is the one that I'm really going to get into, just give you an idea. A lot of people want to hear about this, is that you can get into health systems. You can become part of that team that I was talking about earlier. And so the person I'm focusing on here, this is the students that are in their P4 year. And this is Dr. Mora right here. She's actually one of our faculty, and she's training these students, but she also works at a hospital. So her job on a daily basis is this. She goes around with the students, whoever she's training, along with the doctor, along with the nurse, and other medical students, all those, and they do rounds every single day. They see patients every day. Her job, she's an infectious disease pharmacist. That's her specialty. So she sees only patients with infectious disease. She also sees them when they leave the door. So they came in taking this medicine, this medicine, this medicine. Now you have 3 more. How are you going to take them? They have to see her. So the idea that's going to happen at the end of this, she has her own clinic, and she's going to tell them, look, in this much time, you should be feeling better. If you do not feel better, you come see me, a pharmacist, and we'll try to work out how we can make you do better, right? And so the pharmacist is getting a bigger role in patient management. And that's something that's new, that a lot of people don't realize that's new. And then obviously you're the drug expert. And so that's one of the things that you have. So she's in a clinical practice. She works in a hospital. She's an infectious disease. You work in teams. And she provides education. Obviously, you're always watching out to make sure that everybody's good. That everybody is works together so they can actually take care of a patient. I get distracted by the phone. They rang on me. But anyway, let's go on. So you are the medical expert. I want to stress that in an environment of where the doctors and nurses are there, you actually are the medical expert. So you're the person that understands the contraindication, allergy responses, and you understand that all the different things, why, we need to change this to another drug to make sure that this person gets maximum healing. You are a problem solver. When you guys y'all are going into interviews, that's what we look for. We're looking for problem solvers. We're not looking for people to get angry. We're not looking for people to be like these politicians and yell and do all kinds of crazy stuff. You go to an interview, you're a problem solver. That's who you are. Okay. We immunize. We have been immunizing. We do flu shots every year. We do other things that we do. So it's something that we're very happy about. And as a health science center, we can actually even give COVID. So some of our students who are working at the Walgreens and all that, they're actually doing immunizations for COVID right now. And they're pharmacy students. They're not actually, they're not out there. They don't have the degree yet, but they have certifications for immunizing. So anyway, what I'm going to cover is infectious disease and talking about how infectious disease have become very resistant. And it's basically looking at the career of Dr. Mora has. And of course, it's a global thing. Drugs are becoming much more resistant. How does this happen? Does anybody know how this happens? Why does a drug become resistant? Why does a bug become resistant to drugs?
We're basically just applying a selective pressure to the bacteria. So the bacterium that are resistant,
Yeah.
whatever the mechanism it is,
But what's the theory of them becoming resistant? One of the big ones is not taking all your medicine. So one of the big ones is not taking all your medicine. So here you already have a couple that are kind of resistant, and this person in particular did not finish taking all his medicine. So then these two guys survive. Now, the thing that's crazy about this is that these can then flourish, right? And then you have a resistant strain. Then they can pass it on to other strains that didn't have anything to do with the initial dose. So that makes it much more scarier. That makes it much more scary. And the other scary part of this is that the production of drugs, like for example, this drug is resistant to this bug is resistant to this particular drug, right? And so in order to attack it, you gotta keep making drugs to hit it a different way, right? Well, they're not doing that. They're making less and less drugs every year to be able to do these things. So there's a lot of concern about these resistant strains. And there's a lot of theories of how this happened, coming from cows, from hospitals, all those kind of things, passing it on to other people. So they don't know how they become resistant. They just know what happens. Just like that COVID, how does COVID keep switching? And they talk about changing, people, human to animal and all that kind of stuff. That's the theory, right? That's the theory. So where we're going on this today is to give you an idea where MRSA stands on these evolution of resistant type strain. You have a bug, right? A bug that's been there for a long time. We know this bug. In 1944, it was treated with penicillin. It was a great medication for that. And by 1961, it became resistant. So what do? They switch it to methicillin, right? And then all of a sudden you start seeing resistant strains for methicillin. So that's MRSA, is MRSA. So that's resistant to those drugs. And then you get vancomycin tied in. Then all of a sudden you get resistance towards vancomycin, and then you get intermediate resistance, and then you get this full resistance. And the thing about this bug, it's the same exact bug. It's resistant to different drugs, and that's what makes it kind of weird. It's like kind of scary that you got this one bug that can survive all these things. It's like a cockroach, right? It's never going to die. And so you're trying to get rid of it, and you're having a lot of issues, right? And so MRSA is and I'm going to show you some ugly pictures in a minute, which is always good. I think I have them on here. Makes it more fun. It's bacteria, right? And so what happens is it's very difficult to get rid of if you get it, if it's a resistant strain. It can cause you. I had one person actually had an infected medication, and they injected into his knee, and they almost had to do some bad things to his knee. So we leave it at that. And so that was very bad. And so this is what happens when you get MRSA. Now let me explain how easy you can get MRSA. There is MRSA everywhere. Okay, it's a lot of different places you don't think it is. Okay, my brother got in a car accident. His brake stabbed him. Basically, something broke, some kind of piece of it that was kind of like a rod. and it went in his leg. And it didn't go in very far, but it went in his leg, and he got MRSA. Now imagine this, okay, that you can't get rid of this. You have this oozing coming out, and obviously you don't want it on your face, but you get this oozing. He had this for 6 months. He had it for 6 months of this kind of oozing happening out of his leg. He had it just at the top of his calf is where he got stabbed with that rod. And so it takes a long time to get rid of. So how do you get rid of these things? So the pharmacists and the doctors all get together, and they try to figure out, oh, how we're going to treat this. And so what they do is, even though the resistant strains are not working by themselves, they're doing combinations now. They're actually doing different type of combinations. And what they do is they keep hitting it. And the reason it took them 6 months is because they would do a combination. Is it working? No. Another combination. Is it working? And so they take the ones that they've known have worked in the past. And he was oozing for 6 months. I mean, that's just, I couldn't believe it lasted that long. That was not a good thing. And so MRSA is something that's very much resistant. It's actually dangerous. People have lost their careers of it. Like a football player had it in his knee, and he couldn't, and that was it. He was done because they took a chunk out of his leg when they had to do that. They didn't take his leg, but they took a chunk out. So that you have to treat these things. And so understanding how these medicines work and how you can combine them is something obviously we see with AIDS, right? They have combination type medications, all those things. So it's something that we always, we kind of take for granted, right? We're all healthy. You're not going to run across this, and all of a sudden you have something oozing out of your face for 6 months. Then you're definitely going to not be thinking it's not for granted. So obviously prevention is a big deal, right? Prevention is a big deal. One of the things that we always talk about is that, okay, we're going to treat you, but it can't hurt you, right? You want to make sure the consequences of your treatment is not going to be toxic to you. And so you got to be careful when you start mixing and matching these things. And public safety, and then also you got to figure out, is this going to be something that's going to be cost effective? Are you going to be able to treat everybody the same way so everybody can heal? And so that's one of the things that you always worry about when you're doing this, and you work as a team to solve these problems. You work as a team to get these done. And so it just gives you an idea how pharmacists can do when they're in a hospital environment, and what they do in a hospital environment, how careers have changed. And so this is my contact information. I made it short because I know you guys are late and super tired. And I just want to give you an insight, and I'm interested in people, anyone that's interested in talking to me, meeting up. I'm more than happy to meet with you. I could have gone through the whole pathway of getting into pharmacy school, but I'll give you the gist of it. 3.4 GPA, PCAT about a 60 percentile is probably average when the PCATs come back. Oh, no, yeah, 60 percentile. In those two are the two main things that they look at. They are doing MMIs now. So if you know about MMIs, you can look up on the web. Medical schools do MMIs. They're well, it depends how far they go on MMIs. Most MMIs are there is 1-to-1. You have actually 10 different rooms you go to, right? You're meeting 1-to-1 on one person. So of those 10, the majority of them will be 1-on-1. You get a humanity question. You don't get a science question. You don't get a medical question. It's a humanities question. In other words, what would you do if you saw this happen? How would you think you would fix that? And that's what you answer. And you got 5 minutes to answer. Then some people try to torture students, and they actually go on into doing like role playing. You describe this object to someone, and then they have to draw out the object, and it's like a team building kind of thing. And then they reverse it. And then before this, they had other things where they did little things where they put 4 people together, and they would have to figure out the best way to make things work, and you'd be judged on those things. We don't do that. We just do the 1-on-1, so we're good. And a writing station. So look up the MMI system so you can do the best you can for the interviews. And that's about it. I mean, just contact me, contact people, contact the medical school if you're interested in medical school, all those things. Make sure you contact people on that. And it's all about talking to people. It really is. Get in these schools, understanding exactly what you need to do. Don't listen to other students. Other students always try to psych you out, and they say you need a 4.0, you need this and that. I'm telling you, 3.4, 60% PCAT. You'll be interviewed by lots of pharmacy schools in Texas. Guaranteed. Lots of them. More than one for sure. Okay. And gig them. All right.
And
I kind of had a Taylor coming this way. Oh, go ahead.
So I know I've asked this like before. Every time you talk, I ask this just so people know. The benefits of being a pharmacy tech and applying for pharmacy school.
Oh, amazing. So being a pharmacy tech, just in general, what are you going to cover for the 4 years you're in pharmacy school? Top 200 drugs. So as a pharm tech, you cover the top 200 drugs. Okay. The next thing, what you're going to be doing, you're going to be visiting sites. And so, for example, your second year, we every Friday we either put you in a retail setting or we're going to put you in a hospital setting. So you're already a pharm tech. You know what a pharm tech's supposed to do. So you're going to be very comfortable when we put you out there. And obviously, your third year, you do clinics again, and then your fourth year, that's all you're doing is clinics. So the more you're comfortable you are as being in that environment, it just makes pharmacy school easier. Knowing all the drugs, knowing generic versus brand is extremely helpful. None of the classes that you take to be a pharm tech will count towards anything in pharmacy school. It won't count towards any of the prereqs or any of that stuff. But it's invaluable. It's a great thing. And then the other thing it does for you is, a lot of students don't quit their jobs. I don't know if y'all know that. A lot of them, it's hard. Some people need to work in order to stay focused. Some people, if they work, they fail. But a lot of people like to work and they stay focused that way. And so we'll have students working, 1 or 2 days a weekend on the weekends or during the week a little bit. And if you're interested in staying with that company, of course, we're not going to tell you quit. Don't quit. That's the job you're going to get when you get out. And so you get your foot in the door. That's very important to get on that. And then you get ideas of, like, when I'm in pharmacy school, hey, Walgreens thinks I should get a business degree. So we offer a master's in business. A lot of colleges offer a master's in business. So when you graduate, you actually have a master's in business. Now, the cool thing that we do, I don't know what the other schools do. Say you only got into the program with 75 hours, right? The master's in business will accept you. You only have to take 3 prerequisites, and then you get into the master's program, even though you don't have a degree. You don't have a bachelor's degree in anything, and you still can get into that program. So the idea, you graduate in May with your PharmD, and you graduate with a business degree at the same time. You can find out other things that they want you to emphasize, like Spanish, or they want you to emphasize on different things, so you can focus, or into getting into where you want to be, and position yourself the best possible way. So having that inside connection to companies is always very positive. And plus, it pays more than the minimum wage. If anyone doesn't know that, you start off if you have the pharm tech, you'll start off like 11 or 12, and then if you're experienced, you'll be at $15 an hour, as a pharm tech. And so I tell my son, he's not even interested in pharmacy, he's gonna go be a pharm tech. I say, that's a good job. You're inside, no heat, and you get paid well. You might get yelled at, but then you say, talk to her, talk to the pharmacist.
I can confirm. So kind of like tailing off that, because I have my pharmacy tech license. Of course, I'm planning on going to medical school, but I have plans.
So it's going to help you for the top 200 drugs. What do you think you're going to do in medical school? You're going to have a head start on all those drugs.
Yeah. And then kind of like tailing off of that, do you think like getting an IV certification and working at a hospital would be kind of like additional like bonus?
I mean, you're going to get points. Certain schools definitely put bonuses into the more experience you have, the better off you are. But just experience wise, I mean, anything you can get experience wise in any environment that is in the health related field. I mean, I've done lots of different things. I mean, I've worked in labs, I've worked as dishwasher, I've worked as research, I've done hardcore research. I used to draw blood in the mornings. And so I've done lots of different things that give you an idea and appreciation of other people in the field. And so I think the more experience you can get, the better off you are. I really do. I've never swayed anyone of not working unless their grades are suffering. That's the only thing I've ever done. And anything in the field is always going to open you up to new ideas, because you're going to find out, being a physician, I don't have to have a practice over here. I could probably do this over here. I can do that. And you're going to find out, like I got a PhD. So when I got here in 2007, and they said pharmacists can do all this stuff, and I'm going like, man, I should have been a pharmacist. I could have, because I know a lot of pharmacists that, when they're older and they're getting closer to retirement, they've had 4 different changes. They went into retail, they went into research, they went into policy, and then they finished up with us in academia. And all that happened there was their money went up every time they went up. And I'm going like, man, I go, that's nice. PhD, I have to go find a university. They're not as much fun. Not dissuading anyone from getting a PhD. It's worth it if you love solving things. Any other questions? So again, do not be shy. Go to that U of H thing. It's free. Go meet, if you're thinking medical school, go meet every single medical school person. Tell them to send you their handouts. What are the minimum requirements? And tell them that you're going to contact them later and say, look, this is my transcript looks like, what's your advice? What do I need to improve on? They will help you. Not everyone, because they have thousands of people that are sending in, especially medical school and dental school and vet school. Man, they have thousands of applicants every year. So it's not easy to get in. So knowing somebody in there is helpful. It's helpful. That's all I got to say. It's helpful. So you definitely want to get an idea of what you need to do and find out what, where you stand at this point. And they'll tell you point blank, this grade's not going to, you have to retake this. And that's always a good thing. You're not wasting your time. That's what you want to do. You want to minimize the time you waste. You want to optimize everything you do. And if it turns out you can't go there, I initially I did 3 different changes. I was going, because math is my topic. And so I was going engineering. And back then, I'm so old, we did it by hand. No, that was a no. So and then all my friends were going into medical school. And so biology was my second favorite topic. And so I started going to trying to get to medical school. I actually had an interview, and I'm very, very happy I never became a doctor, as a physician doctor, as they always say, because I really love research. I love doing what I do. The research is something I really like. I like the exploring things. I'm a puzzle solver. I really like solving things. Even if it's the smallest thing, it's kind of cool that, hey, I did that. And even though it's little, it's still fine. I'm happy with that. And so for me, that was the career that happened. And sometimes a no at this place is an open door somewhere else, and you follow it, and that's it. And don't be ashamed of it. No big deal. You're working out. And the other thing is, everybody has a complex. Well, I'm 22. I'm getting old. I have to get into school, and I got to get to medical school. Everybody has a different road. We have people 18 years old in our program every single year, to all the way to almost 50 or older. Every single class has that. We have people that are applying in their 40s, people in their 30s, 20s, and 18 and teens actually applying to our school, and they get in. And so if it takes you to your 40 years old, then fine. Like I always tell people all the time, I didn't get the job that I wanted, which is this one, the real job that I was gonna do for the rest of my life, until I was 40. So, it's just one of those things. I always tell people, your path is your path. Do not compare your path to someone else because you weren't ready for it. Your path is your path, and so you're going to get there. Just remember, don't get frustrated if other people move forward. So those are things that I always tell people, because I think it's important for them to understand. Expectations should be your expectation, not someone else's. And enjoy yourself. You're young. Have fun.
Yeah, that makes me feel better. I've been here for a while.
Yeah, no, it is. That's the way it is. That's the way it is. So, all right then. Any questions? Anything I can add to? Again, if you want to contact me, if you put your information there, I'll probably send you an email next week. Probably early next week. It's just touch base and see what you're interested in and when you're thinking about to get into the program, all those things. So just let me know. And obviously you can go through Morgan if you didn't put out their name. She can give you my contact information, and you're more than welcome to talk. And I talk about other careers too. I know, like the person from the medical school, I know the recruiter there. He'll be at U of H for the recruiting things, so you can visit him there at U of H. And so, it's a good thing. They're all good fields. I mean, I really am. I don't discourage any fields that you're interested in, because there's a lot to it. There's a lot to it, and you must love what you do. That's the most important thing.
Fernando's a great guy.
Yeah, Fernando, you know him? Yeah, he's a good guy.
Yeah.
He's funny.
I had him I was in the jam program over summer, and I was lucky enough to score with Texas A&M, so I got to know him pretty well. Him and Miss.
Oh, wow. Did they take you? Did you go up there for the summer program, like the little boot camps they have, like 1 week and all that kind of stuff?
It was all over virtual, because I mean we're still freaking out over COVID, and still
They actually get you to do surgery.
rightfully so. I mean, it still kind of sucked over Zoom. It's like, man,
yeah,
we got to see a whole lot of people. We got to talk with a whole lot of doctors that we wouldn't have been able to if it was just like in person, but still missed that in person.
Well, the thing I think is crazy is that medical school, that you don't even spend 2 years in class.
Yeah.
You only spend like 18 months or something like that, actually sitting in the classroom and then practicing over here, practicing over there. They have really great facilities there. I mean, they're amazing facilities as far as like training wise. And then you're out doing rotations.
Yep.
It's like, really? You got these guys out there that quick? And it's like, it's less than 2 years, and then you do just over 2 years of just practicing, doing these rotations. I'm going like, wow,
Yep.
that is that. Yeah, we wait for our students. Our students go 3 years on campus, and we don't do summers, so you have the summers off, and then 1 year you're out there rotating. So we're a little different in that sense. So that's why I thought that was interesting that y'all get to do that. But you'll love that campus if you ever visit it. They have this whole hallway of just patient rooms and really cool stuff, and they have a great simulation systems where you have those simulation. You actually get to put in the tube, and you and a nurse are working together, and someone's pumping, and it's actually pretty cool.
Funny thing is I live about 30 minutes north of Bryan College Station, so.
Oh, there you go. You go.
I've been to BCS my whole life, so I mean I'm pretty familiar with the A&M school system.
Yeah, it's a neat school. We actually don't sit on that campus where they're at. They're actually on West Campus. They have their own campus over there going towards Blinn, and we actually sit on the main campus. We sit right in front of the on Universal Drive in front of the vet program.
Oh,
so we sit on the main campus.
Okay.
That's where we sit. So our students actually like that, except for the traffic.
Yeah, no, University at 5, no.
Well, the thing is there's food on the university. West Campus, not really a lot of food.
There's not much there.
So that's one of the differences. And you get to see a lot of students. So a lot of people like to see a lot of students. The other one is just a bunch of serious, medical students and nursing students. Any questions? Everybody good? Let me know if you get in. Tell Fernando hi if you see him.
Can do.
Thank you so much for speaking.
Oh, good. Hopefully it wasn't too short. I was just trying to make sure that y'all didn't go fall asleep. I've been having students fall asleep on Zoom. I go, you guys there? We had this today. And then I'm like, you gotta talk to me. And they're like, no, I don't want to talk. I'm like, fine.
Nah, you had perfect timing. Usually we end at like right at 7 and it's 6:53. So you
Yeah.
did so good.
Okay, good. I just wanted to make sure that I didn't overdo it. Overwork them, I say.
No, you were perfect. And then I've got your contact information, so I'll share it with the members too.
Okay.
And then hopefully you hear from them.
I hope so. I hope so. We got a couple of students from there applying this year, so I'm very excited.
Awesome.
So yeah, usually it starts with 1 or 2, and then after that you start getting 3 or 4, and
Yeah.
you get a nice build up after that. So it's a lot of fun. And one thing just to let you guys know, I know medical schools like this, but you don't stay together too long. But like pharmacy school, it runs like high school. Same thing with medical school, in the sense that your classes are predetermined. There's very few electives. And you start your first year, you have 120 students. All they are taking the same exact class. So you're gonna become friends really, really quick. It's kind of like high school. You're gonna become friends. You're gonna make lifelong friends. We even get marriages happening in pharmacy school, which is always interesting, because you get all these people that are like-minded. And so, I mean, you went through undergrad. How many people you meet that have the same career plan you do? You got 120 people in the same room with the same career plan, basically. So that happens quite a bit. And so, you move to your P2 year together, you move to your P3 year. So you can see how people really, really get close. And so that's one of the things that pharmacy school, we promote it here a lot in our school for students to help each other. You don't need to go to school and be all like, well, I'm going to beat you, or I'm going to, I don't want you to do better than me. That's no good. That's no good. And so we don't promote that. We promote students to work together. And if someone's having trouble, pick up your brother, pick up your sister. Don't be throwing them to the side and say, well, you're not going to make it. That's good. More room for me. All right. Don't do that. Be cooperative and helpful if you can. It'll all pay off at the end. So that's what I like about pharmacy. What I see after when they get out, lots of friends. I mean, I'll call one guy and I say, hey, do you know all these people? And they go, yeah. And they're still in contact. From 2010, they still have maybe 20 of the students that stay in contact with. So these kind of become fraternity type things. All the fraternity things y'all didn't do in high school, in college, that's what happens. You kind of become this little fraternity because you're together all the time. And so it becomes like a little fraternity. So you're going to make friends when you get there. It's not going to be that lonely. It really won't. Right away, you'll start making friends if you're scared of the schools. All right, then I'll let it go.
Thank you again.
All right, it was a pleasure talking to you guys, and y'all take care.
Have a great night.
Thank you for the invite. Don't forget me.
Of course not.
All right. All right, bye.